Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Dr. Carolyn Matzinger, founder and director of the Matzinger Institute of Healing, Diplomate of both the American Board of Internal Medicine and the American Board of Anti-Aging Medicine, and a foremost specialist in anti-aging and integrative medicine. Thank you so much for joining us today, Dr. Matzinger.
Thank you for having me.
Can you share a little bit about your practice and your background and what initially motivated you to go into medicine and ultimately practice functional medicine?
Sure. I have a healing center located in Henderson, Nevada. And I'm one of 3 centers in the world that perform these type of services. They're intensive membrane stabilizing medicine treatments. And we use a combination of IV lipid infusions along with biomedical lipid colon cleanses. And our focus is to optimize cellular function and address epigenetics. I went to undergraduate school at Ohio State University in Columbus, Ohio, and I went to medical school at Wright State University in Dayton, Ohio, many moons ago. I graduated medical school in '87. Trained in internal medicine, so did my 3-year internal medicine residency, had your traditional internal medicine practice, outpatients, and then would see patients in the hospital. Then I moved that went on for years. Then I moved from Ohio to Las Vegas, and I began doing hospitalist work. And hospitalists, that back then, now it's pretty common, but back then it was just up and coming. A hospitalist is a type of specialist in which when you're admitted to the hospital, then a hospitalist like myself, we would take care of you while you're in the hospital, and then once you were discharged, you would go back to your primary care physician. So I did that for a few years, and even when I was in Ohio, I knew that there was something more to medicine than what we were doing. Before I even heard about anti-aging, functional medicine, metabolic medicine, anything like that, I would say to patients, well, if you would exercise more and adjust your eating plan, you wouldn't need as much insulin or high blood pressure medication. But a lot of patients are very stuck on, I'd rather eat cakes, cookies, pasta, and just take more insulin or more blood pressure medication. When I came to Nevada, one of my colleagues introduced me to functional medicine, anti-aging medicine. So I went to my first A4M conference in Chicago in 2005, and from there I said, this is what I've been looking for, and it just took off from there.
Did you complete your fellowship?
I was the first graduating class for the Advanced Fellowship Program with A4M, and board certified and a Diplomate as well.
So what initially inspired you to open the Matzinger Institute of Healing?
So our son Harley, who's now 14, he has a rare genetic condition called Angelman syndrome. And when he was 6 years old, he was challenged with seizures. So we went the conventional medicine route. He was on 3 seizure medications and dying in front of us. In December of 2010, I came to one of the A4M conferences, and I went up to one of the physicians and I said, this is what I'm dealing with, what do I do? He said, Google Patricia Kane. She's the queen of fatty acids, and she's in New Jersey. So I subsequently met Dr. Kane. She told me what to do, get this blood work, put him on this eating plan, these oral supplements, and so now it's January 2011. And within 48 to 72 hours of learning, of putting our son on this particular eating plan and oral supplements, he became seizure-free and off seizure medications. That was January 2011. We're now at May 2018. He remains seizure-free and off seizure medications. So I met Dr. Kane and I learned about her lipid therapies. So as a result of our son Harley, met Dr. Kane, learned about lipid therapies, and that completely, so Harley inspired Matzinger Institute of Healing. So now I have patients coming from all over the country and from other countries as well, coming in for treatments of these membrane stabilizing treatments.
So you have built quite a reputation for treating complex patients. And in fact, physicians send you their difficult patients. Is that correct?
Yes. So yes, physicians are, and patients are hearing about me from other patients, from family, friends, referrals, and from other physicians who have the complex patient, and we're able to take care of them. When you understand what the problem is, then you can, when you get to the root cause, then you know what to do. And what we do, our focus is optimizing cellular function and addressing epigenetics. And an epigenetic event just means an environmental toxin that is sitting on the DNA, and it modifies gene expression. So you can see all these different toxins. So the therapies we do clear toxins off the DNA. They clear viruses, bacteria, and mold, in addition to stabilizing, optimizing cellular function. I tell patients come to me and they say, is this going to work? You know, because I joke with my husband and say, we should just change the name of our clinic to Last Resort Healing Center, because those are the patients that show up. They've been to multiple other practitioners. They've been ill for several years. They've put out thousands of dollars in spending on treatments, and then they show up. They're in tears, like, is this going to work? And I say to them, number one, do you believe that this is going to work? And number two, because we're optimizing cellular function, addressing epigenetics, the only place to go is up. So there's going to be improvement. Everyone wants to get, they want to get well right away. I have to tell people, healing takes time, because they didn't get this way overnight. It's going to take time to stabilize cellular function, clear those epigenetics, and on the road to recovery.
So you have received quite the accolade from Dr. Pamela Smith, who, as you know, is medical director of A4M and MMI. So she said, and I quote, "When there is a patient that I personally cannot fix, I send them to Dr. Matzinger. She is a fellowship graduate and owns one of the top medical centers in this hemisphere for treating complex patients." So why do you think that you're her go-to clinician in terms of complex patient cases?
As I learned more and more about lipid therapies and my practice grew, people just talk to one another, and again, there's only 3 clinics like this in the world, so that's what we do. And I enjoy doing it. It's from my heart. It started with our son Harley, and because of that, it's expanded. And I go home and I whisper in his ear. I said, you're helping so many people because of you.
That's incredible. So can you delve into how your practice utilizes specific groundbreaking treatments, and including like your IV lipid infusions and biomedical lipid colon cleanses?
Sure. So in our intensive treatment program, we do blood work first. You always want to do blood work because you got to see where the patient is. So I explain to people, you don't just start taking blood pressure medication without checking your blood pressure first. So you've got to get your diagnostic data to see what you're dealing with, to know where to fix the imbalances. So we start there. We always do oral supplementation and an eating plan, because nutrition is the foundation of all health, okay? So whether you're going to do any other treatments, you always want to do nutrition. From there, we take a look at what particular treatments do they need. So we do IV lipid infusions. We do a medical lipid colon cleanse, because the gut is our second brain. So it's very important to heal the gut. Other therapies, we do a doTERRA Aroma Touch light massage session. The purpose of that is to decrease inflammation and to support the immune system. So they have the Aroma Touch session first, then the medical lipid colon cleanse, then from there, the infrared sauna. And all of these therapies decrease inflammation, support the immune system. And then we have there's ongoing maintenance therapies and ongoing maintaining the eating plan and the oral supplements, because again, that's going to continue maintenance and continue the patient to be well.
You say that you're a last resort. So who is your typical patient that comes to Matzinger Institute?
From pandas to ALS to Lyme, mold, peripheral neuropathy, random neurological conditions. People just come in for health and wellness. You don't have to have anything going on, but the goal is prevention. You'd like to, because when you look at what's happening on a cellular level and look at what's happening on the DNA, you may not have had a major event, whether it's cancer or ALS or a stroke or something like that. You want to prevent that. So with these therapies, we just stop it before it even gets started. So we've got people just coming in for rejuvenation. Hormone receptors sit on the cell membrane. So because we're stabilizing the cell membrane, hormone balance is improved. Fertility is improved. I had a patient who was pregnant, and once a month she would get an IV lipid infusion, and her newborn miles ahead of your standard newborn child, because we're putting the phospholipids to help with the brain.
So does it ever surprise you to see the success that these treatments have?
Yes, all the time. My staff and I, we're always blown away at the transformation that happens with patients.
So where do you see your role and your clinic's role going in the future? And are there other modalities and treatments that you're evaluating that you're excited about?
You always want, medicine is always evolving. So this is what's going on right now, and there'll be something else, 5-10 years down the line. So, it's just important to continue to stay educated.
Do you currently have any mentors, or have you had any along the way?
Dr. Patricia Kane, she's the one that created the lipid therapy. So she and I work together. Actually, there's many physicians. We have a think tank that, we all work together. Someone has an issue with a patient, and we can, consult one another.
So in your presentation today, you were speaking about the complex patient. So what more specifically were you speaking about?
I went through just give some background history of membrane medicine, membrane stabilization, what that meant, so that as I presented the case studies, the docs would have some, background as to what I was talking about. So I talked about, history with some education regarding membrane stabilization, how we approach the patient with diagnostic studies, history, nutritional exam, and then, the treatments.
So your audience was filled with like-minded physicians who are used to seeking, outside of the box treatment options. Have you had to face any criticism along the way from any of your colleagues in your community?
When people don't understand, when they don't understand or they're uneducated about something, people make ignorant comments. So they just don't know any better. Okay, I know what I do. I know the results that I have a walking 14-year-old testimony son that I look at every day, so I know this works. And then I have multiple stories with patients. I mean, patients are looking at you crying, saying, you've given me my life back. So you go with, that's evidence. That's my objective data right there. So that's what I work towards.
Is your practice primarily a fee-for-service practice?
Insurance doesn't pay for health and wellness.
So how do you convince the patient that this is money well spent?
They're coming to me, so they know when they show up, they know that it's fee for service. And nowadays, most patients know that when you're coming to your non-conventional practice that doesn't accept insurance, that they know it's out of pocket. And it doesn't matter how much money you have if you don't have your health. What do you have? So people are willing to, they do what they need to do for their health. And this isn't for everybody. Some people are perfectly happy taking 10 different medications a day and having the side effects of that, and going to their primary care doc, spending less than 10 minutes with them. I have this symptom and you get a prescription. Some people are perfectly happy for that. The people that come to see me are the people who are sincere about wanting healing, because this is what we're doing. We're healing, not just masking a symptom.
So do you find this type of practice liberating and rewarding? I can imagine you do.
Because we actually get to practice medicine. We actually get to make a difference for patients. Yes, it's very rewarding.
So would you have any advice or pearls of wisdom for a clinician who is considering transitioning their practice to an integrative or functional medicine practice, or someone perhaps just starting or completing the fellowship?
I want to say It's a leap of faith of stepping out of the mainstream and believing in yourself, and more importantly, believing in what you do, that your intention is to do what's best for the patient. So when you have that as your driving force, things will line up for you the way they need to in terms of stepping out and creating a practice to sincerely heal the patient.
Well, that's great. So, well, I think we'll end it right there, Dr. Matzinger. Thank you so, so much.
Thank you for having me.